Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about pulse points. So pulse points are specific areas in our body where arteries lies closer to the skin surface and you will be able to palpate the pulse. Usually arteries are deeper, whereas in pulse points arteries are closer to the skin and you will be able to palpate the pulse. So there are 9 pulse points in our body. They are temporal, carotid, brachial, femoral, apical, radial, popliteal, posterior tibial and dorsalis pedis. You can always palpate pulse using 2 or 3 fingers, and when you palpating, you assess for the rate and you count for 30 seconds, multiply by 2, rhythm, where it is regular or irregular, and if the pulse is irregular, you have to count for whole 60 seconds. And the strength of the pulse. Strength is the quality of the pulse, and you grade from 0 to +3. 0 is absent pulse, 1 plus is weak pulse, 2 plus is normal, and 3 plus is bounding pulse. Now, the first is radial pulse. The radial pulse is palpated below the thumb and it's in the wrist area along the radial bone. You can tell the patient to extend the arm and palpate below the thumb area. Second is brachial pulse. The brachial pulse is palpated inside the elbow. So it's palpated inside the elbow near the top, at the top of the antecubital fossa. Third is carotid pulse. Carotid pulse is palpated in the groove of the neck. This is the windpipe. This is the groove of the neck. So it's palpated in the groove of the neck or below the jawline between the trachea. This is trachea and sternocleidomastoid muscles. So below the jawline, between trachea and sternocleidomastoid muscles. When you palpate carotid pulse, palpate only one side at a time, because palpating carotid pulse on both sides can trigger the vagus nerve and it can drop the heart rate. Fourth is temporal pulse. Temporal pulse is palpated at the front of the tragus of the ear. This is the tragus of the ear and it's palpated in the front of the tragus of ear. Fifth is apical pulse. Apical pulse is palpated at the apex of the heart, which is located mid-clavicular line. This is clavicle, so mid-clavicular line, left side, and it's at the 5th intercostal space, usually auscultated using a stethoscope. Sixth is femoral pulse. It is palpated in the groin area, midway between, this is pubic symphysis bone, so between the pubic symphysis and this is iliac crus, the hip bone. So between the pubic symphysis, iliac crus, midway between the groin. Seventh is popliteal pulse. Popliteal pulse is palpated behind the knee and it's at the soft spot or the diamond-shaped pitted area behind the knee. You can tell the patient to flex the leg and palpate it at the soft spot behind the knee. Eighth is posterior tibial pulse. The posterior tibial pulse is palpated inside the ankle. So this is ankle. Inside the ankle, between Achilles tendon. Achilles tendon is tendon that connects the heel and the calf muscle. So it runs behind here. So it's between the Achilles tendon and medial malleolus. Medial malleolus is the bony part that protrudes in the ankle. So it's between the Achilles tendon and medial malleolus. You can palpate, it's up here. You can palpate the posterior tibial pulse. And the 9th is the dorsalis pedis pulse. It is palpated in the dorsum of the foot. This is the great toe and the tendon runs down. So it's just lateral to the tendon of the great toe. You can palpate the dorsalis pedis pulse. The tendon of the great toe is called extensor hallucis longus. So lateral to the tendon of the great toe, you can palpate the dorsalis pedis pulse. So today we learned about pulse points, and thanks for watching my video.